I'm Lachlan, one of the co-founders of Halaxy, and we're here today in Geelong, about an hour outside of Melbourne. We're here today to talk to Dr. Jossie Anthony about how he uses Halaxy to run his psychiatry practice day by day.
My name is Jossie Anthony. I'm a psychiatrist and I am the founder of Reflect Health. It's a private mental health clinic. It comprises of different type of mental health clinicians, psychiatrists, psychologists, occupational therapists, nurse practitioners. It's not just about, looking after the patients and providing assessment and treatment. It's also providing a space for clinicians to come and work. I have introduced quite a few people to Halaxy. So there's quite a few ADHD coaches who weren't sure what software to use. They were all quite expensive. So I've told them to try it out. The interface itself, it's quite intuitive. It's easy to navigate through it because it's cloud-based. It's using a web browser. There's a flexibility there. It can work from remotely, different places, as long as you have internet. And the flexibility in this day and age, I think, has been quite helpful. I think it was first and foremost, it was about storing clinical notes in a particular place. Then it was about billing. Then over time it evolved into, we started having locations in different places. And so again, it was so much easier to use Halaxy to move from one location to another with a click of a button. When I first started, I would usually, do the billing and would process it straight away. And that was easy for me because it was just a one-man practice. But what we're doing now is we've automated the billing, and therefore it makes it a lot easier to process the billing, and then the invoice generated, which goes back to the patient. I would say first and foremost is to go to Halaxy, go and have a look around, and then give it a go. Then you can move, from one software to the other. You don't have to do anything other than just go online, log in, and try it out.